Everybody does, but my name's Christy C, and I'm an integrative family practitioner, and I just opened my practice here in Sonesville 2 months ago, actually 2.5 months ago, and part of the practice is to try and give more integrative health information to the community. So I'll be giving an integrative health talk every other month on various topics that either come up frequently in the office in my visits with patients, or just that somebody's saying, hey, I'm really interested in this. Is that something that you could talk on? So today our first topic is chronic inflammation. This is in the news, it's everywhere. It's on the front of Time magazine, it was in the Huffington Post recently. It's everywhere, and it comes up in my office visits on a very regular basis. And I'm seeing Noelle sit down, and I just realized I forgot the first part of my talk, which was to introduce Noelle. You want to come up? Just because Noelle has just joined me in the practice, I found myself a little bit overwhelmed with returning phone calls and messages in a timely basis. So Noelle Ellis is the new office assistant at Acadia Integrative Medicine. So if you get an email or somebody else picking up the phone, this is who it is.
Nice to meet you all.
Thanks. So going back to chronic inflammation, it's something that I talk about in my office visits on a regular basis. So it's nice to have you all here so I can talk about it for more than 5 or 10 minutes and really go more in depth with it. As I was preparing this talk, I figured I may be a little nervous, which I am. So I thought, all right, if I'm nervous and they're all sitting there staring at me, which you are, what can I do? And I thought, all right, I know. I'll imagine you all wearing your underwear on your head. So thank you for humoring me. You're all wearing underwear on your head, and with that, I think I can continue on. We're going to talk about first acute and chronic inflammation, what the difference is between the two of those. Then we're going to go into what the causes of inflammation are and diseases that are associated with inflammation. And then we'll go into what we can do to help and to fix inflammation or decrease the inflammation in our bodies. So this is our first slide. And I like this example because we have a splinter here. First of all, can you see this, or do we need to turn the lights down more? There's one more switch, just, yeah, right by Jan. You're right there. Got it. There. Okay, don't fall asleep on me. Is that better? Yep. Okay. So this is the most complex of the slides that I have. So if you can stick with me through this one, it's going to help you kind of understand where we're going with inflammation. But you have a splinter. This is the skin up here. If the splinter comes and it pokes through your skin, it's going to be covered with the dirt and bacteria here. That's going to start signaling your immune system, hey, we've got an intrusion. We've got to do something. The first cells that are usually on board are called macrophages. Macrophages, words for giant eaters. They come in and they start actually consuming these bacteria and the dirt that came in on the splinter. As they do this, they start releasing chemical signals that are calling in the rest of the immune system. They're saying, hey, we've got an invasion. Everybody, come on, we got to get some help here. That signals the blood vessels to bring in more blood flow, to bring in more immune-fighting cells, and to actually open at the edge of the blood vessel to release these into the space. So as a result, in the area that was involved, you get a lot of swelling, you get a lot of fluid, and ultimately these cells take care of it. They get rid of the bacteria, they get rid of that intrusion, and then it's all gone. They go back to what they were doing before. That's acute inflammation. What we see as a person, you get that splinter in your hand, you've probably all experienced it, you don't get it out. Suddenly you start noticing, hey, this is pretty hot here. And that's from the increased blood flow. You notice that it's also red. There's swelling at the area because of the increased fluids and cells that are coming in. And ultimately you get pain. This is all very normal, and acute inflammation is absolutely critical for our survival. Think about it. If you got that splinter and the immune system didn't come in, those bacteria would multiply, and ultimately you'd have an infection that might turn to gangrene, sepsis, and or death. So acute inflammation is our friend. The problem is when the inflammation doesn't turn off. And we have that heat, that redness, that swelling, and that pain, but the inflammation keeps going on. And ultimately what you get is loss of function of the tissue that's involved. In chronic inflammation, you have, for some reason, that inflammation isn't being turned off. There's some sort of inciting cause that keeps telling the immune system, hey, we've got an invasion here. You need to keep sending in the army. You need to keep sending in those cytokines in order to fight this fight. Problem is, often there's not something that needs to be continued to be fought. And what we get is this ultimately results in tissue damage or some sort of disease. That's the difference between acute inflammation and chronic inflammation. Acute inflammation, that's actually our friend. Chronic inflammation, when it's not taking care of the underlying problem or there isn't actually an invasion there, is where we start to have problems in our tissue function and it results in disease. This slide here I like to call cytokine soup. And don't worry, I'm not going into this. I already said the most complicated slide was that first one that we were talking about. The reason why I bring this up is to just let you know that this topic of chronic inflammation is huge. I could probably give a week-long lecture on it. We're just going to skim over the surface today as far as the pathways that are going on with the inflammation, because it's this involved. You have all of these different types of cells, all of these different types of cytokines and inflammatory mediators. And fortunately for you, we're not going to go there. So you can rate your pain now after you saw that slide and we've gotten through the worst and most challenging part of the top. I've always thought this might be a more appropriate pain rating scale than the one that we use in the clinic, which is, my pain is a 10. That's not how I feel. This is a gentleman that I like to call a chronic inflammation man. And I like this slide. It's the title page of the lecture because it offers us a very simplistic overview of what causes chronic inflammation, some of the causes, and then also what chronic inflammation results in. So we'll start with what causes chronic inflammation. We've already talked about infection. So an acute infection such as bacteria coming in on a splinter will cause acute inflammation. But a chronic infection, something like hepatitis, will turn the immune system on and it will keep going, ultimately leading off into cirrhosis. Injury. So an acute injury, acute inflammation. It results in the repair of the tissue and the inflammatory pathway turns off. Whereas chronic injury, where you're repeatedly injuring a joint through football or somebody who runs a lot, some sort of, that often leads to osteoarthritis and the dysfunction of that joint. Obesity and diabetes. We know that fat cells or adipose cells are just inflammatory producers. The more fat cells or the larger our fat cells, the more inflammation we have in general. And diabetes, as well as sugar, call in those cytokines in the inflammatory pathways as well. So these are a few of the things that cause inflammation, and then we're going to get into what inflammation causes in just a minute. So we've talked about a few of the causes of chronic inflammation, including recurrent injury, chronic infection, the obesity, diabetes. Some other ones that weren't on Mr. Chronic Inflammation include leaky gut. If you have a leaky gut or something like celiac disease, where every time you eat some sort of gluten, you end up having some of that kind of filter out through the intestines and it's calling in the inflammatory pathway of the immune system. Chronic dental disease such as gingivitis. Diets that are high in saturated fats and processed foods. We know that saturated fats, processed foods, a lot of the chemicals that are in processed foods are inflammatory producing. And another one is smoking. Obviously, when you're smoking and you're breathing in tar, you're breathing in the nicotine, it's calling in the immune system and saying, hey, we've got invasions here. If you do that repeatedly, year after year, you end up with ultimately tissue damage or lung disease. So what diseases are related to chronic inflammation? We've talked about what can cause chronic inflammation, but what if we have all this inflammation going on in our bodies? For example, we're obese, or for some reason we have some sort of infection, hepatitis. What diseases are we going to see? So I already talked about osteoarthritis. There's also inflammatory arthritises, such as rheumatoid arthritis. The pathways for this are a little bit different. It's not there's something coming in and causing the inflammation. It's more the immune system triggering inappropriately. In rheumatoid arthritis, we tend to have the immune system just turning itself on and sending out all the inflammatory cells, and these are the cytokines here, into that joint. Once they are entering into that joint, it sets up that inflammatory pathway where you get the heat, the redness, the swelling, and it never shuts itself off. So that's why we get the loss of function, or the joints that we often associate with rheumatoid arthritis. Asthma is also linked with chronic inflammation. So for somebody who doesn't have asthma like myself, I get around a cat or some dust, I breathe that in, my immune system may say, hey, there's some dust, some cat hair, let's take care of that, get rid of it, or we don't really care. Whereas somebody with asthma, that will trigger their immune system to bring in all the inflammatory mediators and set off that inflammatory pathway. What happens is in the airways or the bronchioles, you have that same inflammation occur. So the airways start to narrow and we get an asthma attack. If we have our inhaler nearby, we can just get away from the cat, often that inflammatory pathway will shut itself off. But we know that patients with chronic asthma, if they're able to start looking at some ways to decrease generalized inflammation in the body, they often don't need their inhaler as frequently. Heart disease. This is the one that I think is the most prevalent in the news these days, because there have been clear links between chronic inflammation and why it causes heart disease, particularly cardiovascular disease. So who knows the difference between HDL and LDL? All right, you'll never forget it. I've told some of you this before. So HDL is our good cholesterol. I think of the H as being healthy cholesterol. Whereas LDL is our bad cholesterol. I think of the L as being lousy. So you have your healthy cholesterol and your lousy cholesterol. The lousy cholesterol, which we want to keep down in our bodies, when it comes flying along here through the blood vessels of the heart, the walls of the blood vessels have those macrophages in it. The macrophages come along and they say, hey, there's LDL, this is bad stuff. We have an invasion. We need to attack. So they start consuming the LDL particles, and as they consume those cholesterol particles, they start triggering cytokines in our same inflammatory pathway that we've discussed. This brings in swelling and inflammation to the walls of the coronary arteries, and if left alone for long enough, you'll start getting scar tissue or plaques that build up over this, narrowing the vessels to the point where we could have a heart attack or at least severe angina. Alzheimer's disease has been linked to chronic inflammation as well. The pathways of this aren't quite as well defined as, say, coronary artery disease, but we do know that patients who have Alzheimer's disease have much higher levels of inflammation, particularly in the brain. We also know that they have higher levels of cytokines and that their neurons are actually being attacked by the inflammatory pathway, and they are building plaques or scar tissue in their brain. In India, where they have a diet that is much higher in anti-inflammatory spices and foods such as turmeric, their rate of Alzheimer's disease is about 1/4 of what we have in our country with all of our processed foods. Whether that's actually because of the anti-inflammatory diet, that they haven't actually studied, but I do find that link there to be quite impressive. Cirrhosis is another disease caused by chronic inflammation. I think we're all very familiar with alcoholic liver disease. This one's a pretty straightforward pathway. You drink too much alcohol, it's filtered through your liver. The liver says, hey, you're injuring me. Every extra drink you take, it causes more injury to the liver, and ultimately the liver starts calling in the cytokines and the inflammatory mediators to say, we got to get rid of this. We keep getting injured. That leads to swelling of the liver, inflammation, and ultimately that loss of function or the scar tissue buildup, which is cirrhosis. The cirrhosis that we're not as common with, but is actually much more prevalent in our country, is called non-alcoholic steatohepatitis. Got it? It stands, this NASH is an easy way to say it. And it's fatty liver disease. We are seeing lots and lots of this. Remember when we were talking about how fat cells tend to be inflammatory producers? Well, we store fat in our livers, so it's one of those that if you have extra fat in your liver, you start bringing in more of the inflammatory mediators and the cytokines are released. Ultimately, you first just have fatty liver. If it goes on long enough, you start bringing in the inflammatory pathway, you get inflammation, and you get hepatitis or swelling, inflammation of the liver. And if you leave it long enough, it turns into cirrhosis. We know that many cancers are linked to chronic inflammation. We'll go back to our example of smoking causing chronic inflammation. The repetitive breathing in of the cigarette smoke leads to the inflammatory pathway in the lungs. If left long enough, then we often see lung cancers. So the good news is, it says here, the good news is we know what's wrong with you. And then he's holding a stake and a mallet back there as to what he's going to have to do to you. So the good news is we know what chronic inflammation causes. I don't know if it's bad news, but there is other good news, and that's we know what to do with it. So the key components to decreasing inflammation in our body is through lifestyle changes. I wish I could say that it's this one supplement, one thing that you have to do, but if that was the case, I'd have people lining up out the door for this talk. It really comes down to lifestyle changes. Diet makes a huge difference for how much inflammation we have in our body. So it says up here, if you can't read it from the back, you got to start eating out of a different parking lot. And this guy's at McDonald's. So that's the truth, is that we, particularly as Americans, need to start eating out of a different parking lot if we want to decrease the amount of inflammation that's in our bodies and the disease burden that chronic inflammation is causing in our culture. So we'll start with talking about some foods that fight inflammation. The anti-inflammatory foods are really plant-based for the most part. I don't know why they have just tomatoes here, because it's fruits, leafy greens, and vegetables in general are kind of the most important. Then we have nuts, fatty fishes, olive oils, and then most of you probably are aware of foods that create inflammation, that when we consume them, we actually increase the number of cytokines, increase those inflammatory mediators in our diet. And that's our fast food, that's the processed food, lard. How many people have heard of the anti-inflammatory food pyramid before? Cool, all right. I love when I have something to share. So the anti-inflammatory food pyramid was developed by Andrew Weil. He is kind of the father of integrative medicine. And it is a diet that's been pretty well researched to decrease levels of inflammatory markers in our bodies. And it's quite different than what the USRDA pyramid shows. When we look at the base of it, we have our fruits and vegetables, and I know this is tiny print, you don't have to read it. And if you're taking notes, these slides will be online, just so if you want to be able to scour them a little closer. But vegetables, we want to get 4 to 5 servings a day, and our fruits 3 to 4 servings a day. So that comes out to 7 to 9 servings of fruits and vegetables a day. How many of you think you get that? Yeah.
Ask what time of the year we might get.
That's a very good point.
And how big is a serving size?
So an apple, for instance, would be a serving of fruit. For leafy greens, you need 2 cups of leafy greens to be a serving. So it's not, a little tiny portion on your plate. Before I really was getting into eating an anti-inflammatory diet, I thought, I'm a vegetarian, of course I get enough fruits and vegetables. So I actually started counting, and it's hard. But to get this many servings of fruits and vegetables a day is really quite a challenge. The reason why fruits and vegetables are so helpful in decreasing inflammation is all the things that they contain. So the vitamins, the minerals, the carotenoids, the flavonoids. These have all been, in many different studies, individually looked at and how they decrease cytokines. For instance, a study looking at supplementation of the B vitamins has shown, hey, if we give this group a series of B vitamins and we don't give it to this group, let's test their blood for those inflammatory markers, and we see, yep, they're actually decreased in the group getting some of these vitamins and minerals, the things that we find in our fruits and vegetables. So a lot of people say, well, can I just take a multivitamin? Well, it's funny. It just doesn't seem to work that way. I'd say it sometimes can help if you're truly deficient in something, but we find that when our vitamins, minerals, when things are complexed into foods, nature seems to have gotten it right, and it results in much, much more profound anti-inflammatory properties than if we try and take that piece out and just use that separately. So we've got the fruits and vegetables. There is the base of our pyramid here. Next, we get into our whole and cracked grains, pasta, and beans and legumes. And you definitely can't read this, but the whole and cracked grains are there 3 to 5 servings a day. The pasta, 2 to 3 servings a week. And then beans and legumes, 1 to 2 a day. So this is what, again, plant-based is setting up for the basis of our diet. When we get into the next 2 tiers, we have our healthy fats and also our fish and seafood. And I kind of like to lump those 2 together because we start talking about good fats and bad fats. People have heard about some fats are good, some fats are not so good. So our good fats, who can name a good fat for me?
Olive oil.
Perfect. So olive oil is much higher in our omega-3 to 6 fatty acid ratios. Let me get to the next slide. So we have 2 types of fatty acids, the omega-6s and the omega-3s. The omega-6s generally lead to pro-inflammatory products or cause more inflammation, whereas our omega-3s tend to lead towards anti-inflammatory products. Our omega-3s are found in generally fish oil, flaxseed. They're much harder to come by. Our omega-6s, everywhere in our diets. In the US, our ratio of omega-6s is here and our omega-3s are down here. And it's going to be that way. To get more omega-3s and 6s is pretty much impossible to do. But when we take olive oil, that ratio is much closer. We have many fewer omega-6s to the omega-3s. So who's going to remember which one's good and which one's bad? Cool, cool. If you're not, because I never could for years, omega-6 sucks. Okay, omega-3, I don't have one for that. But if you think 6 sucks, I mean, it's not that 6 it's just that ratio if you have too much 6. So the goal isn't necessarily, well, it's to decrease our omega-6s by not eating the processed foods, but really in the anti-inflammatory diet, it's looking at increasing how many omega-3s we get. So if we go back to our anti-inflammatory pyramid, food pyramid, you'll see we're eating the healthy oils that are low in that omega-6 to 3 ratio, and then supplementing with fish and seafood to get more of those omega-3s. We'll also go on, and the next tier is whole soy foods. So soy is good. There's been a bit of a debate out there as to whether soy is good or bad, and should we, because of the properties of soy, be concerned in breast cancer patients or not. And in general, I feel like the survey has come out and said soy is good. When I talk about soy, I talk about whole soy foods like edamame or tofu. If we're eating tofurkey or the soy processed cheeses, okay, here and there in moderation, but that's not really getting you the soy that you need. Then we get into things that we tend to just not eat a lot of, but we know that they have very strong anti-inflammatory properties, like cooked Asian mushrooms. Lots of studies showing that mushrooms in general have great anti-inflammatory properties. So throwing these into a stir fry you're making, very beneficial.
So they have to be the Asian mushrooms or like a...
So,
Oh.
so white button mushrooms, none.
Okay.
As far as portobello, anybody have? Sheila, you?
I have mushrooms. Parachutes not being...
Yeah. Yeah, it's really those that have the anti-inflammatory punch. Unfortunately, yeah, the white button ones we get at the store are not that helpful. Side note, if you take your mushrooms and you put them out in the sun, they actually develop vitamin D so that you can get an oral form of vitamin D. Kind of cool. I came home one day, my husband, who's also a physician, had our mushrooms out on the porch on a cookie sheet. And I was like, what are you doing? Sunbathing. So then we get into our other sources of protein. This is the part of the pyramid I have the hardest time with because I love eggs and I love cheese, but really they're recommended only 1 to 2 times a week. If you are going to have eggs or cheese, they do make an egg that chickens are fed high omega-3 diets, so they have more omega-3s in them. So I don't know if it's a gimmick. We'll see what the studies say down the road. Then we get into our healthy herbs and spices. Things like turmeric, ginger have been shown to have anti-inflammatory properties. So if you can combine these in your cooking, you're going to get more of that anti-inflammatory bang. Tea, particularly our green teas, but white and black teas have anti-inflammatory properties. So if you're going to choose to drink a beverage other than water, definitely reach for a tea. Then we get into the things that in moderation can be helpful. So some supplements, and I'll talk about this at the very end of the talk, are red wine. For women, 1 glass a day, men 2 glasses a day. Otherwise, we're back in that cirrhosis slide that's saying we're getting too much injury. And then our healthy sweets such as chocolate. So it says down here, it's good that you're eating more fresh fruits and vegetables, but be careful to chew more thoroughly. Sometimes that's how I feel after my 7 to 9 servings of fruits and vegetables a day. So the next part of our anti-inflammatory lifestyle changes is incorporating exercise into our daily regimens. They've shown in many studies that exercise actually decreases the number of cytokines and pro-inflammatory mediators. And so this one here says, it's the patient, fitness experts say your muscles need plenty of rest between workouts. And the doc says, well, your last workout was 17 years ago. So exercise, weight loss, we've already talked about weight loss is very helpful for decreasing inflammation because as we decrease the size of those adipose cells, we have less inflammation being produced. And then there's direct effects of exercise on the immune system and on the inflammatory pathways by decreasing those cytokines. This one says, stress management is for wimps. We know that stress reduction decreases inflammation. The medical community and researchers have done lots of studies looking at different ways of reducing stress and how that decreases the cytokine levels and the pro-inflammatory markers once again in our body. This I find particularly fascinating. We all have a vagal nerve that runs from our brain down into our abdomen. The vagal nerves are calm down nerve. So if we all take a breath, which we should have done at the very beginning of this talk, that's going to signal our vagal nerve and it's going to cause it to be stimulated. You think as the vagal nerve is stimulated, it actually turns off the inflammatory pathway. It decreases the number of cytokines out there. This is such a well-known pathway that in patients with severe rheumatoid arthritis that is unresponsive to medications, they'll actually put a little stimulator in here on the nerve, the vagal nerve, and it just stimulates the nerve. And what they found is by continually stimulating the nerve, they decrease the amount of inflammation in these rheumatoid arthritis patients and they get significant improvement. So lucky for us, there's other ways of stimulating our vagal nerve, such as taking those deep breaths, such as doing a mindfulness type of practice. There's another neat study out there that they did looking at mindfulness in an 8-week mindfulness-based stress reduction course. And I'll put a plug in here I'm going to be offering this course in the springtime. What they did, they had 2 groups. One was taking this 8-week mindfulness course, and the other group was being given some sort of healthy living course for 8 weeks as a control. They were injecting the patients or the subjects' forearms with something that was inflammatory producing. And then they were measuring in that tissue how many inflammatory markers and cytokines there were. For the group of patients who had just the regular old healthy living lectures for 8 weeks, they actually saw, as you would expect, you're injecting some inflammatory producing things, an increase in the number of inflammatory markers and cytokines, increased inflammation in the area. For the group in the 8-week mindfulness course, they saw a decrease in the inflammatory mediators in that area, despite what they were doing, the insult. So I think that's a pretty strong testament that learning mindfulness, learning stress reduction is incredibly important for decreasing the inflammation in our bodies. Sleep, also been shown to decrease inflammation. Who knows how much sleep the average adult should get? 18? That sounds good. 7 to 9. So I often, when I ask patients, I say 6 to 8. Less than 7, we tend to not be doing the repair that we need. And it needs to be quality sleep. If somebody has sleep apnea or some other sleep disturbance, that's not going to get them into the REM sleep that we need. Busy slide, but the important parts are lack of REM sleep leads to a release of cytokine, inflammatory cytokines, and you can't see that at all, chronic inflammation. So we need to make sure we're getting restful sleep. This says a rare skin disease, but there are pills for that. And as you can see, he's got tattoos of pills, I guess. So the last thing I'm going to talk about are supplements that are helpful for inflammation. I leave this last because I often think that we look for the, hey, I'll take this supplement and that will solve the rest of this. So this slide says, you promised that you were going to start taking better care of yourself. And the husband or gentleman here says, I am. I just took my vitamin. And she says, yeah, after eating 2 deep-fried Twinkies, washing down a Flintstones vitamin with a Coke is not a good start. So I'll go back to the supplements. And so taking these and going out and eating McDonald's, sitting on the couch and sleeping for 3 hours a night isn't going to work. But using these where appropriate. If you're somebody who's not getting enough omega-3s in their diet because you can't get a quality fish or you just don't like it, and fish oil may be an appropriate supplement. Vitamin D, we know low levels of vitamin D are related with increased inflammation. So it's often something that I recommend for pretty much all patients that we should be supplementing with vitamin D because we live in Maine. And even if you're outside, you're not getting the intensity of sunlight that we need to bring our vitamin D levels up. A multivitamin, we discussed this earlier, sometimes that can be helpful, particularly if you're one of the 70% of Americans who doesn't get the appropriate US RDA recommendations for our vitamins and minerals. We talked briefly about turmeric and ginger. These both have incredibly powerful anti-inflammatory properties. I'd prefer to see you cook with them, but if you don't like everything to taste like turmeric, sometimes supplementing, particularly if you have a particular condition. Turmeric has been shown in some studies to be as effective as Motrin for osteoarthritis, so sometimes I'll recommend that for somebody who's looking for relief but doesn't want to take a medication. Green tea, we talked about before. Probiotics, these help with that leaky gut by repairing the flora of the gut, decreasing that chronic injury to the tissues around the gut. We also have SAMe. It is a very powerful anti-inflammatory, also excellent for depression. So if somebody comes in with depression and arthritis, I say, hey, let's try some SAMe. It's often a good one. And then coenzyme Q10, also a very powerful anti-inflammatory medication. So, in summary, acute inflammation is important and very necessary. Chronic inflammation is what results in disease and loss of function of our organs and tissues, and that's where we start to run into problems. Chronic inflammation is implicated in many different conditions and diseases, and the inflammatory pathways can be stopped or at least decreased by these lifestyle changes that we talked about. Eating an anti-inflammatory diet, regular exercise, stress reduction or practicing mindfulness, adequate sleep, and appropriate supplements. And with that, does anybody have any? Oh, I forgot. So I like this because it's hard to take it all in, but if you keep remembering that the future isn't a place you are going to go, it's a place that you create. So, questions. We have about 10 minutes for questions if anybody has any.